Roxy, thank you for coming to share your time with us here and to help us learn more about this idea of tailoring, what it is, someone who's wanting to develop the skill, what kind of things they need to pick up. And I know with the teaching you've done, with the years of therapy that you've done, not to mention living in the home with Milton Erickson as his daughter, there's quite a bit you can share with us.
Well, thank you. It's a pleasure. And I'm always willing to share my ideas.
Yes, okay. So to get started with this, in the most basic terms, what is tailoring?
Tailoring is the ways that the therapist modifies their behaviors in order to make a closer connection with the client.
Okay, okay. And so this means in modifying our behavior, does this mean in modifying your techniques and modifying, what all are we modifying?
Well, basically, the therapist comes in with the ideas and thoughts about how to conduct therapy, and the patient comes in with hopes and expectations and needs. And so there's that initial connection, and in the initial interview, there has to be some sort of clarity about whether the skill set of the therapist and the way of doing therapy really is going to meet the client's needs. So in the initial interview, there is discussion about the expectation, about the hopes, about the way that the therapist does therapy that begins to express itself in ways that will then guide the progress of therapy as it unrolls. Since there isn't a really clear-cut framework for Ericksonian therapy, there is a lot of variations about how much cognitive insight can be expected, how much review of the patient's problem, how much emphasis on various aspects of it. And all of this needs to be looked at in the context of the patient's expectations. So as that is discussed and negotiated and understood, what tends to come out is a lot of elements that are that kind of show the therapist things about the client's belief system and their expectation, and then it's a matter of using those ideas that the client brings to the office and to use them in a productive, positive way.
Okay, and like Jeff had mentioned before, these things, some of these competencies are overlap or kind of dovetail into one another. And so if we want to be good at utilization, we need to be ready to tailor the therapy experience to the needs of the client.
Absolutely.
Okay.
And so when you're seeking to better understand the client's needs, I start out with inviting the client to describe their problem in their own words, as much time as it takes, in their own hopes and their expectations, whether it's realistic or not realistic. I want to hear their story from their point of view, and I want to really listen to what they're expressing. As they express that, the therapist is going to begin to hear information about the client's perception of the world. And some of the perceptions are, very overt, their belief systems, etc. And sometimes it's very small information there, whether they're referring to visual images, whether they're more kinesthetic, or whether they're sensory oriented, whether they catastrophize, so what their hopes and expectations are, and whether they don't like to talk or do like to talk. And so all of this information that is passed along kind of indirectly through the behavior of the client
Yes.
is then offers information so that the therapist can then begin to tailor their way of communicating with the client.
Now, this sounds like the exact opposite of what we think of when we think of classical or traditional hypnosis, because when I'm thinking of traditional hypnosis, I'm going to have an induction method that should work with you. I'm going to do my induction method. When you're in a trance and kind of open to suggestion, communication's a one-way street, and I'm seeking to influence you, and so everything's going to be traveling this way toward the subject to have whatever outcome occur that we need to remove the warts or whatever it is, decrease the pain. What I hear you saying in this approach, the influence is more like a two-way street. And there's ways that the clients, you're allowing yourself to be influenced and highly responsive to some things the client's saying and doing.
So early in therapy, one is gathering information, what ways of expressing stuff is meaningful to the client. What do they value? What are they looking for? What are their expectations? And at the same time, in addition to gathering that information, the therapist is also assessing whatever problem the client brings in and what might be therapeutic suggestions. Because truthfully, people come into therapy many times because they don't know what to do and they want to be told what to do.
Yes.
So it's kind of a balance of finding a way to offer suggestions, but to offer them in a way that the client can really hear those suggestions and really let them soak in a meaningful way.
In a meaningful way. And this is like, even if you are telling the person what to do or being a little more directive, you've done so in response to what the client's communicated to you, versus maybe, say, someone who's trained in a strict way to be non-directive, they wouldn't go there. They wouldn't make that adjustment and give the client specific concrete things to do.
Exactly. So you have that balance of permissive and directive suggestions that the therapist can make. And most of the time, my default is permissive. I don't know when, I don't know if, I don't know how. Those are permissive suggestions. And most of the time, that's kind of the base where I start. On the other hand, sometimes clients come in and they want to be told, you will stop smoking cigarettes, or you will lose your craving for alcohol, or you will not have this other undesirable behavior. And they really are seeking an authoritative directive.
And they want you to use harsh terminology even.
Yes, absolutely. Sometimes,
I've encountered these clients.
Right, sometimes even really negative suggestions.
Yes.
So part of tailoring is listening for what the subject is hoping for, expecting, what the subject believes is going to most help them, and then to involve that in the suggestions that are offered. And it's not only the therapeutic suggestions, it's also the context of hypnosis. When the client comes in, sometimes they're saying, well, I need hypnosis for, whatever it is that they believe that they need it for.
Yes.
And so part of working with the client is educating them about what hypnosis may or may not be useful for, how it's going to look, what it's going to look like. So part of it is actually some negotiation about the therapist's therapeutic style, and bringing that kind of the first session, bringing all of that on the table.
So if a client asks you to do something that's impossible, I want to lose 100 pounds in 1 week, or if they ask you to do something that's unethical or something like that, you're gonna negotiate.
Well, and it's not only the things that are so overtly some clients come in, they want a past life regression.
Yes.
You know, that's what they're requesting. They're very clear about it.
Yes.
I don't do that.
That's not your thing.
And so there has to be that initial negotiation for what is or is not
Okay.
available in this therapeutic encounter.
But even with the negotiation, still there's a two-way street of influence. Where
Absolutely.
you are willing to be influenced by the client and by their needs.
Well, you certainly, there has to be an understanding of whether we're a match.
Yes.
And, you know, it may be that this therapeutic relationship isn't the optimal one for this particular client.
Yes.
And so in the process of gathering the information about what the expectations, what the hopes are, concurrently gathering the way they express themselves, the way their posture, their hopes, what they're willing to express, all of those details of information, that becomes useful if the therapeutic alliance is formed and if the agreement to work therapeutically together goes forward. By the time that agreement is cemented, you have all of these kind of details of information. This is how the client expresses himself. This is what they're expecting. This is what they're wanting. This is what their hopes are. And you've got, that gives you a lot of good material to work with. Yeah. So if you go from there into just therapeutic suggestions, or if you go from there into a hypnotic work together, you've got some working material as a starting place. Yeah. Now, as you continue to work, you need to do some additional tailoring. You don't know everything. You're going to observe how the client responds to the suggestions that are made. You're going to observe, the therapist is going to observe to the best of their ability and notice what responses the client is giving, and then use those responses to shape where they're going from there.
This, you caused me to think of something interesting, an exercise I do with therapists, and they think they're going to hate it, and they think it's going to be impossible, because what I'm asking them to do is some hypnosis with each other, but they only have 60 seconds, and then I call time, and they've got to get feedback from the other person and find out, is there something, was I talking too fast, or do you need me to be more directive, or whatever. Get feedback. You have like 15 or 20 seconds, and then we pick back up with the hypnosis. You have 60 more seconds, and then you come back out of it, get more feedback, 15 or 10 seconds, and then we do the last 60 seconds. And people think it's going to be impossible with the interruptions and whatnot to make something happen, and they're always shocked and amazed by the experience that occurs and by the fact that it's not a problem to go right back in.
Right.
And you can just literally ask the person, do you need me to do this differently? Like, is this working for you?
And it sounds like fun. That sounds like a lot of fun. Yeah. It's not the only way. Some people do really well with interactive trance. And the interactive trance can give ongoing feedback.
Either through finger signals?
Well, either finger signals, nodding, or verbal conversation. Some of my colleagues do a lot of interactive trance work.
Then you're not having to guess.
But it's a matter of style. I don't do interactive trance. It's not my style.
I gotcha.
So it's a matter of the therapist knowing what their own style, knowing what their strengths, working from their strengths, to elicit the best responses from the client.
And of course, we're not just talking about hypnosis here, we're talking about therapy as a whole, and I imagine you do quite a bit of soliciting feedback from your clients so that you know how to tailor.
In therapy.
Yes.
Yeah, I don't.
No, in the broader therapy.
I don't go for the verbal feedback in hypnosis. Right. And partly, or mostly, or even entirely, because I believe that change takes place in the unconscious mind. And that belief of the unconscious being the pivotal point of change, it's kind of a spectrum. And I am very deep in the one never needs to know what their problem is.
Okay.
May never have that aha moment, may never even believe that they had the problem to begin with. But change can take place unconsciously. So I know, I'm aware of what my perspective is. And so for that reason, in my viewpoint, by the time you bring it up to verbal feedback, you're pulling in some degree of conscious awareness. Some degree. Not that is one of those areas of debate.
Yes. There's several people arguing that there are some value in speaking to the conscious
there's
awareness
a lot of people who really believe that. Yes. And there's a very, very valid argument. It's not my style.
Okay, gotcha. Yeah. So, and one of the beautiful things about Ericksonian therapy is that people are invited to, or able to work from their style, from their skill sets, from what they do well.
Exactly.
Freedom for the therapist, freedom for the client.
Mm-hmm.
If I could, if I say it rightly, there's a sort of like a slogan that's, you'll hear a lot of Ericksonian therapists say, that speaks this idea of tailoring therapy, and they'll say, well, Milton Erickson would invent a new therapy technique for each client he saw. And I don't know if it was Christy that said that first, or if it's...
no, Dad said
he would said that.
Yeah. He was fairly adamant that the therapeutic or theoretical frameworks and models just put limits on the therapy for one to give their clients. And so he stated, I invent a new therapy for every client that I work with. He called them patients, for every patient that I work with. And so he really rejected the notion that there was any framework that could go across the broad spectrum. But from a pragmatic point of view, and from trying to learn to glean the strengths of his work, having this loose framework with basic tenets and basic principles is really, really helpful.
Well, what I was going to say as we were discussing this is that your father was a creative genius, and especially when it came to conducting psychotherapy. So how do the rest of us create a new technique for every client we see? How do we?
Well, we do it through tailoring. I'd say, you're listening to this specific client. Mm-hmm. There are specific needs. There are specific expectations, hopes, dreams, aspirations, mm-hmm. whatever it is that they're bringing to the office, and working specifically with what's going on with that client right now.
Okay, so you shift your focus of attention away from the textbook or away from the training course that you were at onto the person in front of you as an individual.
As an individual with unique needs, with unique skills, mm-hmm. with unique talents, and tailor what you're doing, how you're interacting with them, what you're saying, how you're reaching out, how you're communicating. You're adjusting in an ongoing way as that client changes over time as well. That's the other thing. They come in, at the beginning of therapy, and you're working with them in one way, and over time, those need change. Now, one example I will give about that is there was one severely alcoholic young woman that I worked with over a period of years. It took her a couple of years to get sober. Okay. And by the time she was fully sober, she had had a really tragic life circumstance, but She had lost her family, lost all her material goods, lost her looks, lost her teeth, lost her sense of well-being, just lost everything that, that gave her identity. But as I continued to work with her, she, we had different stages. Initially, the focus of attention was getting her sober.
Yes.
That was all the attention was working on that. And then over time, it reached a point where, giving her support to get appropriate clothing so that she could walk out of the street and not feel shunned by everyone around her was quite important. And as we reached that point, I started seeing her in public settings. I want to meet you at, there was an ice cream parlor in Dallas.
Instead of in the office, you met her at the ice cream parlor.
I wanted to be seen with her in public.
Okay.
I wanted her to be seen in public and to notice what it was to have people around her who were accepting her like a normal person.
Yeah, and you made that possible by being there because you helped with security with.
Well, yeah, she couldn't have. She
own.
wasn't ready to do it without the support of someone like me.
Yeah.
But so that was a step, and she didn't quite feel ready for it. But that's the therapeutic coming together, where I'm assessing, well, this is what your needs are. You need to develop social skills, and even though you may not feel like you're ready, it's time to take this step.
It's something you negotiated with her.
Oh, absolutely.
Yes.
Absolutely.
Okay.
And part of that was done through, she trusted me and she wanted to continue therapy, and I was shifted from being permissive and accepting, whereas the initial rules were, we've got to get you sober, then I shifted over to, it's time to develop some social skills.
So I know there's other approaches, and we hear about like Prochaska's stages, where at this phase in the therapy you're going to be this way, in this phase you're going to be this way, in your phase you're going to be. But with those, that's not necessarily tailoring, because that's something that's applied to everybody. Or I know in the interpersonal approach to psychotherapy, the idea is that the person's going to come in more dependent with less of ego development, and then as therapy goes, the therapist backs off and becomes less directive, more non-directive, because the client now can kind of take over things and function more autonomously. But that's also not tailoring, because that's what you're doing with every client. What you're describing is, this is something done with this one person because this is what this person needed.
Right, the individuality, the uniqueness of therapy.
Yeah.
I could see that she needed that little extra push to get on to the next stage of development. And so I modified the way I was working with her. Now, typically, when one's talking about tailoring, they're typically talking about things like the client's expressive style, and whether they talk about the big picture, or whether they're talking about details, whether they just spit it out, or whether they're really detailed and laborious in the way they're describing something.
Or in LP, they'll have the kinesthetic versus auditory.
Yeah, absolutely.
And that stuff.
Yeah, visual, auditory, kinesthetic, whether you use your senses. But it's really quite detailed, and NLP is quite good at looking at those elements that go into tailoring.
Okay.
It gives a very helpful framework for noticing what the client, how they're accessing the world, how they're conducting themselves in the world. But and then it's taking those things in addition to their expectations. Do they have expectations that no matter what they do, life is just going to be the same? Or do they have expectations that if they work really, really hard, things all get better.
Right.
Or the expectations that you can wave a magic wand and do the work for them. So all of those elements are part of the tailoring picture. All of those elements make the therapy for one particular person very, very different than it is for the next client that's coming in the door.
And that captures the essence of it.
Right.
Okay.
Right.
Is there anything for people who are new to this idea or trying to develop the skill, is there anything that you would warn us about or we need to be careful about when tailoring therapy to do it well?
Well, the thing that I consider to be most important is to know, as a therapist, to know your own strengths and weaknesses, to know what you feel is important, and to be true to yourself.
Okay.
And so if somebody comes in and their expectation is they want to do a past life regression, to feel okay about saying, we may not be a match.
Yeah.
But then when you're working, if you're trying to adjust to meet the needs of the client, you've overextended in a way that may not be appropriate either for you or the client. But from my perspective, the most important thing is not to get lost in the details, that you lose sight of what the client is really asking for, what they're really hoping for. And so when somebody comes into my office, as I said, I spend a whole lot of time with this initial interview. What are their hopes? What are their expectations? And all of those other details, are they visual, are they kinesthetic, do they use their senses, do they catastrophize? Do they use a lot of words? Are they comfortable with periods of silence? All of those details are kind of secondary. To me, the most important thing is what are their hopes, and where is that coming from? Is this coming from a belief that it can happen?
Yeah.
And are they ready? Do they have hope? So keeping kind of aligned with what does this client really need from my expertise?
Yes.
Do they need a little bit of hope to get them through the day?
Yeah.
Do they need hope that that there is a better future awaiting them?
Yeah.
Or is it something else?
And we're not getting cognitive overload when we think this way. I'm not having to pay attention to 300 variables that I memorized that I need to individualize around. What is this person hoping for? And I can ask myself this question with a conscious mind, but I don't even have to necessarily, for sure, completely answer it by the conscious mind, because I will be able to get a feel.
You're soaking it in unconsciously. And so my style, and again, I come back to that because I think it's really fundamental. My style is to invite the client to tell me his story, beginning to end, whether it makes sense or doesn't make sense, their truth as they choose to express it. I want to hear the whole story, beginning to end. And as they tell their story, I'm soaking it in, and I'm going into my own naturalistic trance. I'm not fretting and worrying and checking boxes about whether they're visual or the auditory. I'm just taking it in my own naturalistic way, and trusting that I'm gathering enough information so that if we move into a formal hypnotic trance, that something will guide me to meet up with this client in a therapeutic way.
What I hear you saying is it's not enough to know a person's symptoms. You need to know the person's life story, or at least some significant pieces of their life to know them as an individual.
And not necessarily. I've actually had clients that have come in. Well, here's another example of tailoring. Client comes in and he says, I've been in therapy for a long time. I've seen a lot of therapists, none have been able to help me.
Yes.
But I believe that hypnosis can help me.
That's his hope, okay.
So I want you to use hypnosis on me, but I don't want to tell you what my problem is.
No more, okay.
Okay. I agreed, you know, I had enough communication with this fellow. I agreed, okay, I'm willing to work with you. I obviously couldn't give him any guarantees.
Right.
I hope that he would have enough trust in me at a later point in time to share, you know, whether it was successful.
Yeah. But you used a lot of open-ended suggestion.
Oh, well, it had to
permissive
be open-ended.
suggestion.
I didn't even know what we were working with.
was,
I
right.
didn't know what we were working with.
Yeah.
And the only thing that I was able to gather was that he, you know, he had some regrets about his childhood and that his grandmother had been a strong figure. And so he felt that by listening to me in a hypnotic state,
Yes.
he could re-access his grandmother and get things kind of sorted out in their own way. And I thought, okay, I can work with that.
You tailored the therapy to fit his needs.
Right. So I worked with him, and after a few sessions, he was willing to tell me what his problem was about.
Yeah.
Never wanted to talk about the details of it or how it fully expressed himself.
Yeah.
But he still comes in to see me about once every 2 or 3 months. He says he needs a tune-up. And so when he comes in, you know, I say, is there anything I need to know, or you know, anything you'd like to tell me? And most of the time he gives me little snippets of his life. He changed careers, he moved, he changed relationships, he's in a job that he's much more satisfied with. He made a lot of changes. And he credits it all to me, even though I truthfully didn't make any suggestions in any of those directions.
And my guess is if you hadn't been willing to tailor the therapy, it wouldn't have worked. This wouldn't have, fighting with this person's needs, you would have gotten nowhere. He wouldn't have come back.
He'd been to multiple therapists, and they apparently, he wasn't getting what he needed.
Okay.
But now he feels like because I'm willing to adjust and work with what he perceived as his needs.
Yeah.
And I started out with just basic relaxation, open-ended ego strengthening.
Yeah.
You know, that was all I had to work with to start with. And you know, as he began to, you know, express, you know, little snippets of his changing career, well, then I could add in a few things about his newfound changes.
Well, Roxy, in a very short period of time, you've given us a lot of information on tailoring, a lot to think about, some very practical examples. Thank you very much for doing this.
My pleasure.